important things to remember about pulmonary embolism, at least on EKG, is that PEs are notorious for mimicking evidence of ischemia.
Wait a minute, that's not my voice. That's Dr. Amol Mattu.
So one of the very, very common, in some studies, the most common EKG abnormality in the presence of large PEs is T-wave inversions. Now, I don't know about you all, but when I was in residency and med school, I learned that T-wave inversions equal cardiac ischemia. Not so. T-wave inversions can be cardiac ischemia, but it can also be PE. And as I mentioned, there are some studies indicating that T-wave inversions are the most common abnormality with PEs. The other thing that I never learned in residency was that you can get ST segment changes when you're looking at a PE. You can get ST segment elevation and ST segment depression. ST depression is kind of non-specific, but ST elevation is not uncommon in the presence of PE. And in particular, when you see ST elevation in the setting of a PE, it usually tends to be in V1 and AVR. Notice that both of these leads look at the right side of the heart. So this is a sign of right heart strain. If you see ST elevation in V1 and AVR, you've got to think about the possibility that it's a PE. If you also see right axis deviation, then that almost nails your diagnosis of PE. So if you ever are looking at an EKG and saying, you know, this kind of looks like a septal STEMI, there's ST elevation V1 and AVR, and then you notice that there's right axis deviation, that equals PE as far as I'm concerned, and it's not acute coronary syndrome.
I'm super psyched to tell you about a course that Amol Mattu and I are running next April 27th to 29th in Philadelphia. This course is the Static and Sound Conference. I don't think this has ever been done before. This is a combined ECG and bedside echo conference. You'll get everything you need if you take care of people who have sick hearts. We're giving the first 20 people who sign up $500 off registration. The link's below, check it out. More information's coming, as well as a full website.